Good afternoon, everybody. Today we are going to talk about therapies for children with autism. Now, the symptoms of autism involve problems with a child's development and behavior. So, the primary focus of mainstream treatment is utilizing various therapeutic approaches that improve these problems. These programs are a critical part of successful autism treatment, and the earlier the child begins them, the better. Now, each child with autism is unique, and each therapy program must be individualized to meet that child's needs. What works for one child, it may not work for another child. If something doesn't seem to be working, then it should be changed. New approaches should be added, and ineffective techniques should be discarded. There are some primary therapies that should be offered to all children with autism, and there are some that are suited for a smaller proportion of children. Therapies generally fall into four different categories. We have behavior therapies, language therapies, occupational therapies, and social skills therapies. Most children receive daily or weekly therapy in each of these four categories. Now, behavior therapy. This category covers therapies designed to teach children with autism how to handle various tasks and interaction of day-to-day life. It's not only focusing on a child's good or bad behavior, it is also focusing on life skills. And it's also focused on how to suppress the abnormal behaviors and mannerisms. For example, a behavior intervention therapy teaches a child how to ask for food when he's hungry instead of throwing himself on the floor and having a tantrum. It also will show a child how to make eye contact when someone is speaking with them instead of looking away. Most children with autism should spend as much of a day in behavior therapy in the early years. As insulin is to diabetes, behavior intervention is to the child with autism. Now, there are other things that a child should be working on, but everything should be working around the behavior intervention treatment schedule. Depending on the severity of autism, young children should spend between 10 to 40 hours a week on one-to-one therapy with a therapist in a behavior intervention program. Okay, there are several approaches to behavior therapy that are currently being utilized and investigated. ABA, or Applied Behavior Analysis, is the primary method used worldwide, especially between the ages of 1 and 4. Now, there are several variations to ABA, such as we have floor time therapy, we have pivotal response training, or PRT, we have discrete trial training, or DTT. All of these variations have been used successfully with children with autism. We also have something called TEACH, TEACCH, which means Treatment and Education of Autistic and Related Communication Handicapped Children. This is commonly used in preschools. Although all the techniques are similar, there are slight variations, and it's important to determine the best one for your child. Now, because each child with autism is unique, I cannot offer you a specific guidelines on which approach might fit your child best, because I don't know your child, I haven't seen your child. I will simply describe each one, and it's up to you and your therapist to decide which one is best for your child. Now, ABA. ABA is an intensive one-on-one program in which the therapist spends many hours every day working with the child using principles of stimulus, response, and reward. It follows the classic operation of conditioning, which states that any behavior can be changed by changing what's happening just before or after it. Then we reward that appropriate behavior. Now, therapy can take place anywhere. It can take place at a small table, it can take place on the floor, whatever is comfortable for the child and for the situation and the current exercise. The therapist begins by providing a stimulus, which may be asking the child to say something or perform a play-related action or engage in a social interaction. The therapist then demonstrates what the proper response should be. When the child does not imitate the action correctly, the therapist repeats the stimulus and response over and over, or prompts the child physically until the child will do it correctly. Anything the child does wrong is ignored. Okay, this is a very important point, that we must ignore what the child is doing incorrectly. It is ignored or redirected or replaced with a more appropriate response. In some circumstances, the therapist may physically direct the child through an action and then reward him. Rewards might be praise, a brief celebration such as a game or a snack. By repeating the exercise dozens and dozens of times, the therapist teaches the child how to correctly perform the action on his own without needing any stimulus. Now, we have, for example, a therapist might spend a day teaching a child how to say hello to his mother. The therapist will ask the child to say hello to his mother. This is the stimulus. When the child doesn't respond, the therapist will demonstrate by facing the mother, looking at her in the eye, and saying hello. This is the proper response. The child will likely not imitate this action yet, and the therapist will continue repeating the stimulus and response. Now, at some point, she will direct the child by turning his body towards the mother, looking the mother in the eye, and saying hello for the child. She will then face the child back towards herself and reward him with good job, like high five or something like that. Even though he didn't say hello, she is demonstrating the desired behavior and rewarding the child. After this is repeated many times, the child will begin turning to his mother, looking her in the eye, and saying hello on his own, and enjoying a reward from the therapist. The child will eventually learn that turning to look at his mother, saying hello, is a positive experience and will begin doing this on his own outside of therapy. The parent will also be taught how to direct the child through these skills at home. The goal of ABA is to increase desired behavior, such as social interaction, playing appropriate, to teach new skills such as self-help or communication, to maintain these behaviors such as exercising self-control and guiding oneself through tasks, and to understand how to move from one behavior to another, such as working from task to task in a classroom or transferring from one social interaction to another, and to reduce behaviors that interfere with daily life, such as self-injurious behaviors or stimming. Hundreds of everyday communication skills, self-help skills, and education milestones can be taught at one time or another through ABA, one by one. It can take many hours of each day for several years, but gradually the child is taught how to do everything a child should do in day-to-day life, and the child can be taught to want to do it. Now, different forms of ABA. Now, we have different forms of ABA, which I mentioned in the beginning. We have discrete trial training. We have verbal behavior. We have applied verbal behavior. We have pivotal response therapy. They use the same principles as ABA, but with variations. Now, in DTT, discrete trial training, skills are taught individually by breaking them down into small tasks possible. And for example, in the example that I just gave you, turning to the mom and saying hello will be taught in 2 smaller steps. First, the child will be trained to turn and look at the mother in the eye. Once that is established, saying hello will be taught separately. In VB, or what we call verbal behavior, ABA principles are used specifically to focus on teaching speech and communication skills. It teaches very small, measurable units of language, one at a time. The child learns to use words to get what he wants instead of throwing a tantrum, for example. Children are taught to imitate, to make requests, to label objects, and to eventually converse with others. Now, pivotal response therapy. This is also derived from ABA principles, but in PRT, pivotal response therapies, it differs significantly from the standard ABA in 3 ways. First, instead of teaching specific individual behaviors one at a time, PRT focus on several main principles of development and behavior. How to become motivated, how to respond to multiple cues from the environment, and how to self-manage behavior, and how to imitate and maintain social interactions. Secondly, it is child-directed instead of therapist-directed. Thirdly, the rewards are more specific to the behavior. As the child learns these global skills, specific and individual behaviors within these areas are learned without being specifically targeted. The child generally doesn't sit on a table unless he chooses to, okay? Instead, the therapist engages the child in whatever the child is choosing to do on his own. Teachable moments are worked into the child's routine. Rewards are tied more specifically to the behavior. When the child is learning how to ask for a toy, the actual toy is the reward. PRT teaches all the same skills as regular ABA, such as language, communication, social interactions, academic skills, and avoidance of disruptive behavior. But it differs significantly enough from ABA that it could be viewed as a completely different therapy altogether. Now, thank you for listening to me today. And in the next module, we will be going through some other behavior therapies. Thank you and have a great day.